And school was okay for you? You enjoyed school?
Yeah, so my upbringing was slightly different to most. I had a lot of experience, as I said. So from the age of, say, 6 to 16, I had about 45 operations,
Right.
most on my sinuses. So schooling was great, but I had factors that made it slightly more tricky than it would have done otherwise. But apart from those incidences, yeah, I really enjoyed. I enjoyed the camaraderie of school. I enjoyed the experiences of school, and I love sport. Especially my secondary school in particular. I did everything. I
Right.
was captain in most sports. I played chess. I was swimming. I was in the theatre. Um, just trying to take absolutely everything in. And yeah, I really enjoyed that. I didn't love the educational side of it. I found it a bit boring, but
Right.
it didn't do me any harm, put it that way.
Okay. Okay. And the hospitalizations, did they involve going into hospital? Did it involve things like, general anesthetic and all that sort of stuff?
Yes, most of them were general anesthetic.
Okay.
Yeah, so basically, what the long story short, I suffered from polyps and needed polypectomies, and it was mainly in the sinuses. So
Okay.
usually with a polyp, it grows, you get rid of it, and if it comes back, it doesn't come back for a long time. But for whatever reason, my body was generating them far quicker than any normal person.
Sure.
And it's quite a rare situation. I think there's only a handful of cases that are like this in the world, in
Uh-huh.
fact. So I am a phenomenon, which is always nice. Um,
I guess why I'm
and
asking is because we know there's these things called ACEs that happen, adverse
mhm,
childhood experiences,
yeah.
and hospitalization can fit into that category and can have consequences, no matter how wonderful the hospital staff might be, and they would be, but going under is frightening. And if you're having multiple ones when you're developmentally immature, I'm sure that has some sort of psychological impact.
Yeah, absolutely. I still remember certain moments which are and I say terrifying. I don't think it's the right word, but wholly
I think it
uncomfortable.
probably is the right word.
Well, maybe, but
I think
exceptionally
if you're a
distressing.
child, it's going to be, isn't it? I mean, that's all right. I mean, the way I think about it is like this: that when a child experiences something, they've got a small mind and a small set of experiences that can't encompass it because they are small, both in terms of life experience and physically and all that sort of stuff. So even if, as an adult, we look back on something and go, "It wasn't that serious," when we're this big,
Mm,
it was because it was that big to
yeah.
us. When we're this big we're sort of the same size as the experience, so it doesn't really matter.
Yes.
But actually, when we're little, the experience is overwhelming. So you had a lot of those, and
Well,
I
yeah,
imagine, yeah, they had some impact.
I would say, regardless of the size of the human, they were traumatic experiences. I remember one instance. So I sometimes had packing in my sinuses after the operation, which is like the worst thing. It's probably the worst part of the operation in many respects
Right.
because you had to get it out. And that was, if you think about from a young child, you've got loads of stuff like in your sinuses. You've obviously got lots of blood, blah, blah, blah. And it was the worst experience ever. And they used to kind of put this thing where they'd almost be able to pull it out. But I remember one instance, I hated it so much, I fought against it. And as
Right.
the thing came out, it literally sprayed the room with blood.
Yeah.
Um, you
Well,
know,
those are
that,
terrifying experiences.
that's an
That
experience.
that counts as terrifying, mate. Just listening to it, I'm going, oh, I don't want to hear that.
Yeah, it was that was bad. The other one I almost died, which was quite a severe scenario.
Okay.
So I um
So here we
so,
go. That's okay. So I,
so
I, I thought maybe, possibly he's sort of minimizing the impact a little bit.
yeah, look, you deal with it. There are experiences and you deal with things and you learn, you progress. But so this instance, so if you've ever had a general anesthetic or if you've never had it, so you either have gas, an injection.
Yeah.
Those are the two main things that most people use to put you to sleep. Now, as a child, they didn't really like using injections, and I didn't like the cream, the numbing cream. For whatever reason, that was worse for me, the numbing cream, than a
Okay.
lot of other things.
Yeah.
So anyway, so we did the gas and air. Literally, gas is the worst thing possible. I hated it. I hated the smell. I hated the taste.
Right.
I just absolutely hated it. So I think I must have had it in a previous operation, and some of my operations were back to back, almost 3 months apart.
Right.
You know, which wasn't normal, but it happened. And I think on this instance, they actually, if I'm right in saying I think they either put the gas kind of facing my face, um, and oh no, actually maybe they put it over my face actually, the mask, so I couldn't get away from it. The
Yeah.
first time it was kind of directed towards me.
Like
Um,
suffocation. Yeah.
yeah, so because I hated it that much, I decided to take a huge gulp of air, held my breath, and hoped that would be all
Um,
right.
yeah.
What happened was my mum was in the room where they put you to sleep, and then usually when I was asleep, she'd leave and whatever else. Um, so I obviously went to sleep, and my mum was there, and she kind of said to the doctor or the anaesthetist, "Why is he going blue?" So obviously I'd held my breath, I'd knocked
Is that
myself out
normal?
unconscious.
That's that normal, blimey.
Yeah. So they kicked her out the room pretty quickly.
Right.
Um, did whatever they did. And I'm here to tell another tale. But you know, no, honestly, this is one thing out of a lifetime of experiences for me. And
Sure.
I look back and I do I feel privileged to be alive in some ways.
If you like this video, please don't forget to like, comment, and subscribe.